Hey there. Are you using the birth control pill, or maybe thinking about starting? You're not alone. Millions of women around the world rely on the combined oral contraceptive, or COC, as a safe and simple way to prevent pregnancy. In this video, I'll cover everything you need to know: how it works, how to take it correctly, what to do if you miss a pill, common side effects, and more. Let's get into it. Alright, let's start with the basics. What exactly is this pill? The combined oral contraceptive, or COC, is a tiny tablet you take every day to prevent pregnancy. It contains two hormones, estrogen and progesterone, which are actually similar to the hormones already found in a woman's body. The standard pill pack you get has 21 active pills with hormones, and 7 iron pills, which don't contain hormones. These are just to keep you in the habit of taking a pill daily. Each hormone pill has 0.03 milligrams of ethinylestradiol and 0.15 milligrams of levonorgestrel. Those are the active ingredients. Okay, so now that we know what's in the pill, let's talk about how it actually works to prevent pregnancy. The COC mainly works by preventing ovulation. That's when your ovaries release an egg each month. No egg, no pregnancy. The hormones in the pill, estrogen and progesterone, build up in your body when you take it daily. This higher hormone level prevents your ovaries from releasing an egg. Simple as that. It also thickens the mucus in your cervix, making it harder for sperm to get through. So, it's kind of like double protection. Now, you might be wondering, is this method right for me? Let's talk about who the COC is best suited for. The pill is great for women in a variety of situations. If you're newly married and not ready for a baby just yet, wanting to space out your pregnancies, looking for a temporary method to stop having more children, or even if you're widowed, separated, or just at risk of an unplanned pregnancy, the COC could be a good option for you. But of course, it's always best to talk to a doctor or midwife first. Alright, next question. How effective is it really? Let's look at the success rate. When used perfectly, the pill is over 99% effective. That means fewer than 1 out of 100 women will get pregnant in a year. But here's the thing: it has to be taken every single day, around the same time. If you miss pills or take them late, the effectiveness drops. So, consistency is key. So, how exactly do you take it the right way? Let me break it down for you. First, start your pill within the first 5 days of your period. That's the best time. Then, take 1 pill every day, at the same time, ideally after dinner. Why after dinner? Because it helps reduce nausea and other side effects. You'll take all 21 hormone pills, then the 7 iron pills. Even during your period, you keep taking the pills, no breaks. Once that pack is done, start a new one the next day, even if you're still bleeding. So always make sure you have your next pack ready. Now, let's talk about something super common. What if you forget to take a pill? It happens. Here's what to do. If you miss 1 or 2 pills, no stress. Just take one as soon as you remember. Then take your regular pill at the usual time. Even if that means taking 2 pills in 1 day, it's totally fine. No need for extra protection. Alright, let's say you've missed 3 or more pills in a row, or you started your new pack 3 or more days late. Here's what you should do. First, take 1 pill as soon as you remember. Then, take your next scheduled pill at the usual time, even if that means taking 2 pills in 1 day. That's totally fine. Keep taking the rest of your pills as usual, 1 each day. But there's an extra step. You'll need to use a backup method, like condoms, or avoid sex for the next 7 days, just to stay protected. Now, Depending on where in the pack you missed the pills, here are 2 important situations to know. In addition to the above instructions, if you missed pills in the first week, the first row, and had unprotected sex, you might be at risk of pregnancy. In that case, talk to your doctor about using emergency contraception, like the morning after pill, or even an IUD, if needed. If you missed pills in the 3rd week, the last row of hormone pills, here's what to do. Take the remaining hormone pills in the current pack, skip the 7 iron pills, and start a new pack right away. Don't wait for your period. As for the iron pills, if you miss one, it's okay. Just throw it out and keep going with the schedule. Let's talk about how long you can actually use the COC, and what happens when you stop. Good news, you can use the pill safely for years, even up until menopause, as long as you don't have any health risks. And when you stop taking it, your fertility returns quickly. The pill won't delay your ability to get pregnant later. Now, like any medication, the pill can come with some side effects. Let's go over what you might experience and how to handle it. Some women might experience things like headaches, dizziness, nausea, breast tenderness, mood changes, weight changes, acne, or changes in your bleeding pattern. These side effects usually wane off after the first pill packet is over. Therefore, it is important to explain clearly to the client that the side effects can be minimized by taking the pill after dinner, and it is not necessary to stop the pill. If side effects persist, medical advice must be obtained. Alright, let's talk about managing birth control side effects. Now, the most important thing. Don't stop taking the pill just because you're having side effects. I know it can be uncomfortable, but skipping pills can actually make things worse and raise your chances of getting pregnant. So, it's really important to stay consistent while managing the symptoms. Let's walk through the most common ones and what you can do. First up, headaches. If you're getting mild ones, go ahead and take paracetamol, between 500 and 1000 milligrams, or whatever pain reliever works best for you. Feeling nauseous or dizzy? Totally normal at the start. Try taking your pill at bedtime, or with food. That usually makes a big difference. Breast tenderness? Yep, that can happen. A supportive bra helps a lot, and you can also try a hot or cold compress. And again, paracetamol can help ease the discomfort. Worried about weight changes? Most people won't see major changes, but if you're noticing something, it's a good idea to check in on your diet and maybe talk to someone for support or advice. Mood changes are another big one. If you're feeling a little off emotionally, that's valid. Talk to someone you trust, and if you have any local or traditional remedies that help, feel free to try those too, as long as they are safe, of course. Now, acne. Here's some good news. For a lot of people, the pill actually helps clear up acne over time. If it doesn't improve, you can always explore some local skin treatments. And finally, irregular bleeding. Spotting or weird bleeding patterns can be frustrating, but they are super common in the first few months. It's not harmful, and it usually settles down. If it's bothering you, NSAIDs like ibuprofen can give some relief. But, if the bleeding goes on for more than a month, that's when you should see a gynecologist, just to be safe. Alright, now this part is super important. Who should not take the pill? Let's go over the absolute contraindications. Now, while the pill is safe and effective for many people, there are some medical conditions and situations where it should absolutely not be used. These are called absolute contraindications, and if any of these apply to you, the pill might not be safe. Let's break it down clearly. Pregnancy and postpartum period. If you're already pregnant, or there's even a suspicion of pregnancy, don't take the pill. If you're exclusively breastfeeding, avoid the COC for the first 6 months postpartum. And if you're not breastfeeding, wait at least 4 weeks after delivery before starting, even if the baby was stillborn or passed away early. Heart and circulatory conditions. This one's big. The pill affects hormones that can impact your heart and blood vessels. Avoid the pill if you have multiple risk factors for heart disease, like being over 35, smoking, having diabetes, and high blood pressure, especially if you have 2 or more of these. High blood pressure over 140/90 mmHg. A current or past history of stroke or ischemic heart disease. Complicated heart valve disease. Or a history of blood clots, like DVT or pulmonary embolism. Surgeries. Got a major surgery coming up? If it involves long periods of immobilization, like being on bed rest for over 2 weeks, or if it's a leg surgery, the pill could increase your risk of clots. So it's a no-go. Headaches and migraines. If you suffer from migraines, it can raise your risk of stroke. Breast cancer. If you have a current or past history of breast cancer, the hormones in the pill may not be safe for you. Always discuss this with your doctor first. Diabetes. If you've had diabetes for more than 20 years, or if your diabetes has caused complications like retinopathy, eye damage, neuropathy, nerve damage, or nephropathy, kidney damage, then the pill is not recommended. Liver and gallbladder conditions. The pill is processed through your liver, so if you have active liver disease like hepatitis, severe liver cirrhosis, liver cancer, or a history of gallbladder disease, then COCs should be avoided. Medications that interact with the pill. Some medications can make the pill less effective or more dangerous. That includes rifampicin, used to treat tuberculosis or leprosy, and most anti-epileptic drugs, except for sodium valproate, which is usually considered safe. If any of these apply to you, the pill may not be the right choice. But the good news? There are plenty of other contraceptive options out there, like the IUDs, injectables, condoms and more. Talk to your healthcare provider. They'll help you find something safe and effective for your unique situation. It's your body, your choice, and your right to plan your future the way you want. If you found this video helpful, give it a like, hit subscribe, and share it with someone who might need it. Drop your questions in the comments, we'd love to answer them. Thanks for watching, stay healthy. Stay informed.